Hi everyone, good evening. My name is Ashley Tompkins, and today I'll be discussing with you how good communication is crucial in dental patient care, as well as how maintaining that relationship is vital in a patient's overall health. In 2014, 52.3% of adults were recorded as visiting the dentist every few years, whereas 64.4% of children were recorded as visiting the dentist every 6 months. While the dental visits have increased about 20% since the mid 90s, we're still looking at about 18.2% of children ages 5 to 18 who are living with untreated dental caries, like cavities or root canals, things that need to be taken care of, whereas 26.5% of adults are living with untreated dental caries. A large reason why some people are not visiting the dentist is because of the cost of dental care. However, the other large portion is that 22% of people surveyed said that they are terrified of visiting the dentist about the procedure that they are going to undergo or about losing their teeth. And so that is where good communication becomes a vital aspect of your dental patient care. Due to the fear of dentistry, the 7 C's of communication are a really effective tool that you can use when you're talking with your patient. The 7 C's are clear, concise, correct, cohesive, concrete, and courteous. When using these tools, you want to be brief and to the point. That way, your patient feels like they understand the procedure and that they can ask questions if they don't understand something. It's also really important to learn something new about your patient every time they come in. That way you build a foundation and you can build from there the basis of something that's other than their oral hygiene. That way the next time that they visit, they feel more comfortable and relaxed and not quite as afraid about the procedure or the treatment that they're going to undergo. Another set of really important communication tools to use are conflict management, self-oriented versus patient-centered goals, and cultural sensitivity. In order to ensure that your patient is getting the best care possible, you really need to possess an excellent set of conflict resolution skills, as conflict can arise from a simple misunderstanding or a differences in opinion, values, or beliefs. So you really need to make sure that you are effective at conflict resolution and at de-escalating a situation so that you can maintain that healthy relationship with your patient and you can continue to build on the goals you'd like to set for them. It is also really imperative to be mindful about their self-oriented goals versus the goals that the patient sets for themselves. A lot of times, dental hygienists will have a particular plan in place for what they would like to see in a patient's oral progress and their health. And a patient will have a very different idea of what they want for themselves. So it's really important that you sit down and you communicate with each other and you can create a mutual agreement that you both are happy with and that will get you from point A to point B with as little conflict as possible. It's also really important to be aware of cultural diversity and sensitivity. Because we have diversified so much within the last few decades, it is really, really important to be mindful about the differences of people that you have coming in to your office every day. You really want to make sure you don't offend or make them feel uncomfortable with the situation or the topic of discussion. So just kind of being aware of that and making sure that you're not straying from any topic that is too out there. It's really important to realize that when you can effectively use these tools, it's been proven that patients will hold themselves more accountable to the goals that you have set and that they have set for themselves, because they understand the procedures and the process of which they need to follow, because you've been able to communicate that with them and show them why it is important to maintain the path that they're on. And it is really important that you keep building on that every time they come in, so that your interpersonal communication with them grows and they're able to really understand and feel like they're heard every time they come in and have a procedure. Lastly, the third set of communication skills that you should use when talking with a patient are nonverbal communication, paraphrasing, and environmental factors. So, nonverbal communication is a very useful and very important tool when you are in a dental office setting, because a lot of times it's hard to communicate with your patient when they're in the chair and they're having a procedure done and they have tools in their mouth. So even before or after a procedure is done, when you sit down and you talk with them, it's always important to make very simple non-verbal gestures, as a head shake or a smile. It'll show that you're listening and that you're being attentive to their questions that they're asking or their concerns, and they feel like they've been heard. It's really important to maintain that relationship with them, and make them feel like they have a voice in it, because they do. They are the patient, and it's because of them that you do what you do. Um, it's also really important that you paraphrase for them. So when you are discussing the procedure or the treatment plan afterwards, when they ask you questions, you can paraphrase it back to them. You use their exact wording, and that way they know that you heard them and they make that connection that you understand what they said, while also giving them some additional clarifying details that will help to figure that out. Um, and finally, the environmental factor plays a large role in the effectiveness of your communication. Dental offices tend to be very cold, as some of the chemicals and the equipment require it to be a colder environment. So it's important to make sure that your office is fully clean and lit. That way your patients feel very calm and very comfortable in the setting that they're in. So today I discussed with you how the 7 C's of communication are effective tools, as well as conflict management and self-oriented versus patient-oriented goals, cultural sensitivity and nonverbal communication, and paraphrasing and environmental factors. All of these techniques are amazing tools to use when building interpersonal relationships with your patients. And hopefully by utilizing these techniques, we're able to begin reducing the fear of dentistry and to promote proper oral health for all people throughout the United States as well as the world. So thank you very much.